Okay, good morning to everybody. Visuo-spatial attention processes can be studied using the gap paradigm, a temporal gap between central fixation point offset and stimulus onset typically yields shorter response latencies to the stimulus than if the fixation point remains on. ASD have been associated with deficit in engagement, shifting, and disengagement of attention to visual stimuli. However, the literature on the gap effect in ASD leads to contrasting findings. Regarding eye movements, it's been reported a size reduction of gap effect, an increase, or even a gap effect size similar to that reported by participants without ASD. Regarding manual responses, the only study to our knowledge have reported a gap effect similar to typically developing children in a key pressing task. In the present study, we explore visuo-spatial attention in children with ASD in a gap paradigm. Moreover, we investigated the effective coordination between the oculomotor and limb motor system in our clinical sample. Okay. In this work, we compare 14 children with ASD without mental retardation to 14 typically developing children matched by gender and age using the gap paradigm in 3 experimental tasks. In the look-only task, participants were instructed to move their eyes as quick as possible to the target. Only saccadic responses were collected by remote eye tracker. In the look and press task, saccadic responses were coupled to choice key press responses given on a button with the index finger ipsilateral to the target. In the look and point task, saccadic responses were coupled to manual movements to targets given by touching the stimuli on the touch screen with a 40 cm long wooden rod. Let's get to the results. Regarding visual gap effect, it was found in all conditions, with faster saccades to stimuli on the right. No group differences between children with ASD and typically developing participants were observed. As regard to manual responses, we did not find any between group differences in manual gap effect in the look and press task. However, in the look and point task, we found a significant interaction between the group and condition, gap or overlap, in the sense that the ASD group did not show a gap effect, while the control group showed conversely a manual gap effect. Eye-hand coordination was examined by computing Pearson linear correlation between eye latencies and manual reaction times or latencies. In the look and press task, there was a positive correlation between eye latencies and manual reaction times for both groups. In the look and point task, there was a significant positive correlation for healthy controls between eye latencies and both movement duration and manual latencies. In contrast, there was no such relationship for children with ASD. In conclusion, we confirm previous findings reporting no difference in visual gap effect between participants with ASD compared to healthy controls. Deficit in visuospatial attentive mechanisms may not be evident in gap paradigm studies regarding eye movements. The look and point task reveal a manual gap effect in typically developing participants, whilst children with ASD show no evidence of such an effect. More interestingly, considering this result in conjunction with findings on the visual gap effect, the present study provides further evidence that the neural mechanism underlying the gap effect in the visual and in motor system as a parallel rather than serial organization. Finally, we have provided evidence for a less efficient eye-hand coordination in children with ASD, when a specially oriented manual response is requested, extending findings of Cherry Graysbrook and colleagues. Thanks for your attention.